And now, final presentation from Teemu Suna, CEO from the Nightingale Health, and he's going to share more about the process and experience in changing the work the lab tests are, and building a new workflow of the lab work. So welcome, Teemu, to the stage, and then we will come back, all of us together, for a short panel discussion and closing this panel.
All right. Hello, everyone. So I'm talking today about how we are solving the world's largest healthcare problem. Before going there, a couple of words about Nightingale. So the company is a bit more than 10 years old. We are a biotechnology company, although today I'm going to talk about what we do in healthcare. When we started 10 years ago, the aim has been all the time primary healthcare. And now we are there. I will show you today the product. We are operating in Finland. We have laboratories in Japan, Singapore, UK, US. We have invested to build this technology around 100 million euros. We are publicly listed in Nasdaq Helsinki. And the technology and the capabilities to enable preventative healthcare are globally unique. So let's have a look, and I will walk you through of the preventative healthcare journey. Why is it important, and how we can get it solved? So my name is Teemu Suna. I'm CEO and founder of Nightingale Health. But let's start before going to the product. Let's look at the healthcare challenges. So there are two major challenges. One is the costs of healthcare. Healthcare costs in United States, 18% of the gross domestic product. Now, if you compare this to military spending in the US is around 4%. And we many times talk about that military investments are huge. It's small in comparison to the healthcare costs. But it's not only about money, it's also about suffering. So we are in a situation where people live longer, but the healthy lifespan has not actually increased. So in numbers, the projection of the costs, healthcare costs, it's like 47 trillion. Like, it's a number that makes absolutely no sense. It's so big number that it lose the meaning. But yet we are in a situation that 75% of all deaths are globally caused by preventative diseases. And prevention actually works. Around 80% of chronic diseases can be prevented. That's why we are talking about prevention. Why we are in this situation is because of the healthcare logic that we have currently basically everywhere in the world. Healthcare is not healthcare, it's sick care. What the healthcare is doing at the moment is waiting you to get sick. When you get sick, then they try to save you. That's the logic. The logic is like this because if we go 100 years back, then I mean that kind of a logic was feasible. If you look at the lifespan, if you look at the diseases, if you look at the medicine, but today it doesn't make sense anymore. And then there's a huge conflict of interest. So the more there is sickness, the more there is money. So these are the key reasons why the current healthcare logic does not work and needs to be changed. So I think it's fair to say that the current logic is broken, and where we need to innovate, we actually need to, it's not only about adopting great technologies, it's also about understanding that we need to change the entire logic in healthcare. And how can we do it? We need to adopt prevention of diseases in large scale. There is no way around it. So what happens many times we just talk about prevention, but I have put this very simple picture to visualize what prevention actually means. So here we have the lifespan. So when people get older, the number of sick people increases. What prevention means? We move this line. So we prevent diseases to emerge. We move this line so people have longer health spans. Because in the end of the day, it's the health span that matters the most, not the lifespan. But these two things can be actually combined by adopting prevention. And with this, we can have lower costs. We can have less suffering. And this is all possible when many times when I'm talking with healthcare decision makers around the world, I sometimes feel that they think about like, oh, this is not doable. Of course it's doable. You just need the right tools to do it. With the tools that healthcare is currently using, it's not doable, I agree. But there are ways to make this work. So what is the new logic? And how you can make prevention actually happen? So this is how I strongly believe that we should design the entire health system. This is not a single technology solution. This is a way of redesigning the entire health system. And I mean in the government level, the whole system. So how we need to build it? The first step is that we need to have effective tools to detect the disease risks at scale. So you cannot to whom you do prevention? Not for the ones who are already sick, you do it for the ones who are healthy. So what you aim to do is to detect the risks of developing diseases in the future. And you need a technology that you can test everyone. I mean everyone. The whole population. When you have this technology, you detect the risks, you know who are at risk of developing the disease in the future, you target your healthcare actions to the ones who actually need it. And we know what to do with prevention. The actions are already known. There is no problem with the actions. We know what to do. We don't know to whom to do it. And then after we do the preventative actions and the interventions, one thing that is missing in healthcare doesn't know very well what is the efficacy of interventions. The computer, by the way, will... Sorry, can you put the computer to the charger because it will run out soon. Anyway, healthcare doesn't have very good tools to understand what is the efficacy of interventions. So now when you find the ones who are at risk, you do the intervention, you need a technology that you can detect the efficacy of the action. Now, if you have these three things, what do you do next? Instead of giving money, the more disease you have, the more money you get. You actually give money to the interventions that are reducing the risks. You detect the risk, you do the intervention, you measure if the risk went down. If yes, you fund that intervention. And then you do this in a population scale. This is how you do prevention. Because everything starts from the risk detection in prevention. So the current healthcare system already have tools to do risk detection. We have here in Finland, we have FinRiski for cardiovascular diseases. We in Europe score 2. We have US Framingham score, ASCVD scores. We have the same things for type 2 diabetes. The problem with all of these is that while they do the risk detection pretty well, they need a lot of manual actions. You need to bring in the patient, you need to weight the patient, you need to do the blood pressure, you need to make a questionnaire. It's impossible to do in national scale. So they are nice, but they are very manual. Then we have some of the AI tools. A lot of unrealistic expectations with the AI in this context. The problem is that, yes, you can automate the risk detection pretty well, but if the data to detect the risk is not in the system, in the healthcare system, it doesn't work. You cannot populate molecular data. You cannot populate what is the blood pressure of a person. You just cannot do it. The model kind of works, but it doesn't work if you really validate it. Of course, it doesn't work, the data is not there. So what we do is that we combine the high reliability and automation. Because in our solution, and this is because the key is the risk detection. In our solution, we don't need the manual part. So the patient we don't need to measure blood pressure, we don't need to have BMI, we don't need any questionnaires. We don't need any of that. And still, we get very strong risk detection for multiple disease in one go. So how we do it, and what is the key? The key is blood. There are many benefits with blood. One is that it's easy to draw. Another benefit is that if there is a questionnaire, blood doesn't know, it doesn't have a memory in a sense, it doesn't know how to lie. The molecules are objective. And when you do it only using blood, you have massively good repeatability. Without repeatability, you cannot actually measure if the risk levels are changing with the intervention. So the product that we are offering, we call it Nightingale Health Check. It's a routine risk assessment for common chronic diseases. What does it do? I show you parts of the clinical report. So we take a single blood sample. We only need age and sex as clinical parameters. So the person only needs to go to lab. And then we get a reading of all of these risks. So we detect the risk for heart attack, stroke, type 2 diabetes, chronic kidney disease, fatty liver disease. Everything from a single blood sample. The detection accuracy with all of these diseases is equal or better than the current clinical standard. So you lose nothing, but you save a lot. You save a lot of time. If you think from the healthcare professional's point of view, if you are a clinician, before you see the patient, you have understanding of all of these risks. This is completely impossible with the current clinical workflows. Current clinical workflow is the patient goes in, meets with the nurse, then the blood is taken, then maybe meets with the clinician. There are 2 or 3 appointments before we are here. And then you don't do this ever as a routine measurement, because you only look the risk of CVD, you only look the risk of type 2 diabetes. You only look one disease at a time. This technology, all of the diseases from every blood sample, every time, with perfect repeatability. So this is the summary of the diseases. Then if you look at each individual diseases have also more details. I walk you through how you work as a clinician, how do you connect how you make the patient understand the clinical situation. So in this case, we have a male, 60 years old. We have run our test. The clinician would say to patient, "Dear patient, your current risk for," in this case, it's heart attack risk, is 18%. Now 18% most likely doesn't mean anything to you. However, if you compare the number below 18, it's 6%, which is the average risk for men your age. This means that your risk is actually 3 times higher than on average. And now it's very important that we do interventions, because if we don't, in 15 years your risk is 49%. Every other person gets a heart attack. So let's start preventative actions, because we can change this trajectory. So it can be a very powerful tool to communicate the risk to the patient, because prevention, they're like no magic tricks. This is simple stuff what you need to do. But you need to have the tool to show what is the situation now, then you measure again, and these percentages actually change. And the measuring again, fully objective, you can quantify the change in the risk. So this tracking feature enables for the patient, like now if a patient goes to doctor, there is a big problem internationally with drug adherence. So people are prescribed with their drugs, they don't take it because they don't feel anything. But then if you can make the kind of the tracking using blood, this is only done from the molecules. So the molecules will show you that if you do the intervention, you can see if it's actually working. This works in a clinical intervention. This works also very well lifestyle intervention like nutrition. So there may be a patient, doctor says, well, if you only eat, if your diet is only fatty red meat, that's the only thing you eat, you should try something different. And the patient says, no, it doesn't work, I have read from the internet. The doctor can say, well, let's try. So take 4 weeks, change your diet, come back, measure again, and we will see if it's working. So we need to redefine the logic of healthcare so that the funding system, the KPIs, the whole way of thinking starts from the idea, how do we reduce the risks in a population in a systemic and effective way? Everything starts from the risk detection. This is what our technology enables. It's affordable. Our capacity, by the way, at the moment, we can run this easily for everyone in Finland. I mean, for every individual. It's fast, it's easy to get the sample, it's low cost. The price tag to run this for everyone in Finland is, looking at the healthcare costs, which are in Finland 24 billion. It's nothing, it's a rounding error to do this for everyone in Finland. So my message is that if we really want to change healthcare, we need to get started, we need to adopt these new technologies. And I'm very happy to also share that this is already happening in Finland. We have run this test for around 200,000 people in Finland. This is nationally available as a part of occupational healthcare. And now we are also adopting this in the public in the public healthcare sector. There is already one well-being county starting the adoption, and I'm sure that others will join also this, because I think this is the #1 solution to make healthcare better for everyone. Not only for patients, not only for clinicians, not only for taxpayers. I mean, for everyone. Thank you.
Big round of applause for Teemu.